Fauci, thank you for joining us today. We appreciate you taking time out of your extremely busy schedule to be with us. On behalf of the Georgia Municipal Association and our 537 member cities and 4,000 city officials we represent, we're honored to have the opportunity to hear from you. I'm now going to turn it over to Kelly Bennett and Rushi Patel, who will ask questions that were submitted to us by our members who are in attendance today.
Thank you.
Thanks so much, Larry, and thanks so much, Dr. Fauci, for this extreme honor. So let's get started. Can you tell us about your new position with the new administration and what you hope to accomplish from this role?
Well, my new position is the Chief Medical Advisor. The reason that title was there because the President and Vice President wanted me to maintain what you'd want to call my full-time position, my day job, as it were, which is the director of the National Institute of Allergy and Infectious Diseases, which, as you may know, has been responsible for the development of the vaccines and the therapeutics and all the things we do with HIV and tuberculosis and malaria. But he also wanted to have the opportunity that at any given moment that I would be deeply involved in all of the discussions about medical issues, so that I'm part of the team, that I get briefed on everything we're doing. So a good example of my new role is that this morning, interestingly, I got up at 3 o'clock in the morning to give a 4 o'clock in the morning address to the WHO Executive Board.
Wow.
It was a very important meeting because I gave the message of the president that we were going to rejoin the WHO, that we were going to revoke the Mexico City policy, that we were going to pay our dues, as it were, to the WHO, all things that really had been reversed during the Trump administration. So I gave the speech this afternoon. I'm going to go down to the White House and meet in person with the president and vice president and talk about the strategies for COVID. So all at the same time while directing my institute. So it's an interesting hybrid job.
It sure is, and definitely a busy morning already. So thank you for making time with us, and congratulations on your new position. I'm going to pass it over to my colleague Rushi for the next question.
Thank you, Dr. Fauci, and thank you, Kelly. Speaking of the WHO, they're dealing with a lot of various strains of the COVID-19 virus. How concerned are you about recent and potential mutations of the COVID-19 virus, and how likely are some of these mutations to be resistant to the current vaccines and cause more rapid transmission of the virus?
Well, a couple of questions in there with different answers. So very, very quickly, we take all of these seriously, even though not every mutation, since this virus is an RNA virus and it readily mutates. I mean, that's just what RNA viruses do. Most of the mutations don't have any functional significance, but some of them do. And the ones that are circulating in the UK, the ones that are in South Africa and Brazil, are apparently associated with an increased ability to transmit. Does not appear to have a significant impact on virulence, namely not making you on a one-to-one basis more sick. However, the more people that get infected, the more people go to the hospital, the more people go to the hospital, the more people that die. So even though it doesn't inherently make it more virulent, it's not a good thing that it increases the transmissibility. But importantly to your question, is that what impact does it have on the monoclonal antibodies and even more importantly, on the vaccine-induced response? We have found in preliminary studies that are coming out literally as we speak in the preprint literature that the mutations, particularly South Africa, not so much the UK, and the UK is the one that is now in the United States, but particularly the South Africa one diminishes the effectiveness of the vaccine, but doesn't obliterate it. In other words, it still looks like the vaccines that we are using are effective against the mutants, but we cannot be complacent. We have to follow this really carefully. And if they evolve more and become more resistant to the point where it interferes with the efficacy of the vaccine, then we have to upgrade our vaccines and maybe, whatever period of time, give a boost with a vaccine that does cover those mutants. But for the time being, things look okay. That's why we're saying the best way to prevent the continuation of mutation is to get as many people vaccinated as quickly as you possibly can.
Thank you, Dr. Fauci. That really speaks to the urgency of our situation. Kelly?
Right. Awesome. Thank you. So let's talk a little bit about the disconnect between the firsthand accounts of and advice of public health professionals like yourself and the general public. What can local leaders do to help bridge this gap?
Yeah, I think local leaders, are, some of the most important components of getting the the message to the community, which was, one of the reasons why I was enthusiastic about speaking to you all, because you really want to make sure that the people who are on the ground close to the community are very aware of the information in real time as it comes out, because everything from public health measures to prevent infection to the smoothness with which we roll out vaccines, it's absolutely critical to get local organizations involved in doing that. So congratulations on what you do, because it really is important.
Thank you so much, Dr. Fauci. And we have been working hard at GMA to really equip our members and our local leaders to do just that and spread the knowledge about the vaccine. Go ahead, Rishi.
Speaking of the knowledge of the vaccine, you have consistently urged people to get the vaccine. Obviously, you're confident in its safety and efficacy, and yet large portions of the population, including healthcare workers and minority populations, have been slow to accept the vaccine, and many have indicated that they are unlikely to take the vaccine. What can city officials do to encourage their constituents, particularly those populations who lack trust, to take the vaccine, and what are some of the common fears that need to be allayed?
Yeah, that's a great question, Lucy. And I think, I'm certain that the way we need to go really is, first of all, in the general population, there's hesitancy and maybe resistance that have nothing to do with historical issues that have arisen. What I'm getting at is that I think we have to have a separate message for the brown and black people, particularly African Americans, because we need to respect the fact that history tells us that they have not been treated well by federally funded public health issues, test assess, going back to the days of the Tuskegee incident. And to let them know that we understand their hesitancy, but safeguards have been put in place since then that would make that type of thing essentially impossible to happen again. We've got to assure them of that. But then we've got to go step by step in outreach in a collaborative way, not pejorative, not pointing fingers, not making people feel guilty, and say, all right, what is it that concerns you? Is that you think it went too quickly and that it's not safe? Explain to them that the speed, and it really is record speed. I mean, we went from knowing what the virus was to actually having doses to put in people's arms literally in 11 months, which is unprecedented and truly historic. But it's historic in a good sense, because it really is the result of spectacular advances in the science of vaccine platform technologies. So safety was not compromised, nor was scientific integrity compromised. Then you say, well, is it really effective and safe? Well, you say, well, some people are worried. Well, maybe it's the federal government trying to put something over on us, or the companies trying to make some money. Well, you look at the facts, and we've got to start basing things on facts. And the facts are that the determination if a vaccine is safe and effective is made at the end of a clinical trial involving tens of thousands of people by an independent data and safety monitoring board, a group of people that are representative of scientists, vaccinologists, virologists, ethicists, statisticians. They are accountable to no one, not to the federal government, nor to the company. They look at it completely independently. And when they determine that it's safe and effective, then the company presents the data to the FDA and says, can we let it out now to be administered? The FDA career scientists, not political appointees, but career scientists, they then work with their own independent advisory committee. And when the advisory committee tells them this is now safe to administer, then it gets administered. So the whole process is both independent and transparent. And we've just got to explain the facts to people, because many people think There are things that are behind closed doors that you don't know about. Everything about this is transparent. It ultimately gets published in the scientific literature where everybody can look at it. We have to keep getting that message as at the same time as we respect the hesitancy that they have, particularly among brown and black people, particularly.
Well, thank you. And we're glad to help get that message across to our members. Kelly?
Definitely. Thank you, Dr. Fauci. Now, the rollout of the COVID-19 vaccines, they have admittedly been slower than hoped for, and recent news indicates that the federal government does not have the vaccine dosage reserves it previously indicated. Now, you've shared that the new administration's goal of 100 million vaccines in 100 days is doable, which is phenomenal. Now, what gives you cause for optimism, and what must be done differently to reach this goal?
Well, this is the highest priority for President Biden and Vice President Harris, no doubt. I mean, he's made this very, very explicit. He has a 5-part plan to do a few things that I think are going to make this, as I mentioned, quite feasible. I would be surprised if we didn't attain that goal. That is expanding the groups that get the vaccine, using everything in his power, including the defense, the DPA, Defense Production Act, to be able to get things like needles, syringes, and other things that would facilitate the administration, to involve pharmacies, to involve community vaccine centers, to involve mobile units to go out. Because, you know, one of the things we don't want to happen is that when we distribute the vaccine, people, particularly minorities who are living in areas that are not accessible easily to pharmacies, not accessible to community centers, to be able to, for example, use mobile units to go out there and get them vaccinated. That's all part of the plan.
Awesome. And as a member of the Black and Brown community, I just thank you all so much for that level of intention to reach those hard to reach populations. So thank you. Go ahead, Rishi.
Yes, completely agree. You have stated that new vaccines could be available within weeks, not months. Can you share how many new vaccines are in the pipeline and any key differences from existing vaccines?
Yeah, great question. So the federal government has invested in and is responsible for either the development of and or the facilitation of the testing of like 6 candidates. 2 of them you know about, Moderna and Pfizer, that have already gotten emergency use authorization. Very close behind is a product by Johnson & Johnson, or Janssen, which is the subsidiary of the larger company, Johnson & Johnson. They have a different vaccine platform. It's a single dose. You don't require 2 doses. So really good in that respect. Its cold chain requirements are not as strict as some of the others. Their data are accumulating. They're doing tests in the United States and Brazil and in South America, and in South Africa. And so I would imagine, you know, we talk to them very frequently. Literally within a matter of a week or 2, they're going to be submitting their data to the FDA to determine if they have enough safety and efficacy data to say we can go ahead and start administering it. Then there's AstraZeneca, which is another platform. It's a chimp adeno. Then there's Novavax, which is a completely different one. Again, that's a bit behind, but they're sort of sequentially going to be coming online and be available. And that's the reason why we were talking about not only the Pfizer and Moderna, I think, can get us over the finish line for the president's goal, but pretty soon we're going to have Janssen, Johnson & Johnson online too. So if things work the way we hope they work, we'll be in reasonably good shape.
Wow, that's great information. Thank you, Dr. Fauci.
That is phenomenal. Now, Dr. Fauci, the CEO of Moderna, shared that he believes COVID-19 would likely become an endemic. Do you agree? And if so, could it potentially require annual vaccinations?
Well, you know, we hope that it doesn't become endemic in the sense of having outbreaks, you know, every year. I mean, if endemic means there's a very, very low level of infection, since most of the people are vaccinated, we don't have a serious threat from it. Okay, I'm okay with that. But what we don't want is to have a situation where we have significant outbreaks every year. But it is conceivable. And, you know, one of the things that President Biden told us in some of our first meetings, he wants us always to be totally honest and transparent, not to make excuses, When we don't know something, say we don't know it. And when we do know something, give the data for it. So I have to tell you honestly, I do not know whether we are going to require an intermittent boost of the vaccine. We're going to find that out pretty quickly, but right now we don't know. Will we be prepared for that? Absolutely. We have that in our long strategic plan.
Phenomenal. Thank you.
And I think you kind of hit on this already. When will we know how long immunity from the vaccines might last, and what could this mean from a public health perspective, and how might that impact healthcare capacity?
Well, actually, great question. And you're right. We did indirectly hit upon it. It's going to be a matter of time. Remember, we just started on our phase 3 trial, several months ago. The phase 1 trial started on the phase 3 trial started July 27th. The phase 1 trial started a couple of months earlier. So I think we're just going to have to play it on a month by month basis, following people in the trial. And that's what you call, post-vaccine trial observation, find out just what the durability is. This becomes even more important as we monitor the mutants as they appear. So the question that we asked about mutants overlap and impacts on the question you just asked me about durability.
Oh, that's great. Thank you.
That is. Now, Dr. Fauci, we're hearing a lot about the effects of herd immunity. Can you please share with us why there is such a wide estimated percentage of population needed to achieve this herd immunity from between 60 to 90%?
Yeah, the reason is because we don't know.
Right.
So what happens is that people give estimates. The estimate that I gave was based on trying to extrapolate the efficacy of the vaccine of measles, the transmissibility of measles, and what we know is the need of herd immunity for measles, which is very high. You need to get 90% or more of the population of measles vaccinated. So since the SARS-CoV-2 is not quite as transmissible as measles. Measles is one of the most extraordinarily transmissible viruses you can imagine. And since the vaccine is not quite as effective, it's 94, 95, measles is 98+%, that I figured an extrapolation would make it, in my mind, somewhere between 70 and 85% of the population you would need. Is that absolutely correct? No, I don't know that. And the only way you know it is when you get enough experience that when it drops below a certain level and you get infections and you get breakthrough, then you know about what the level of herd immunity is required to keep infections under wraps.
Great. And I know that you and the administration will keep us in the know with that. Thank you.
Yes.
Yes, thank you, Dr. Fauci. America's healthcare systems are increasingly concentrated in large urban areas, while access to adequate healthcare in rural areas is declining. Much of Georgia's population lives in rural areas that now lack access to basic healthcare services. What can be done to improve rural healthcare availability and delivery, and how has this lack of access impacted treatments as well as deaths during the pandemic?
Well, I can answer the second part of your question, Rusi, by saying that it has been a negative impact. Obviously, you don't need to be a brilliant person to figure that one out, that if you don't have access to care and you have a serious disease that, requires testing, follow-up, availability of healthcare, how we solve that problem, I don't know. I mean, I could wave my hands and guess about it, but that's not in the area that I work in or responsible for. I mean, obviously, getting healthcare available for all is something that the Obama administration really put a lot of effort into. There were attempts to sort of nullify that in the last administration. I fully believe that in this administration, there's going to be a lot of effort put into trying to make that much more available at all levels of society.
Thank you, Dr. Fauci. Kelly?
Thank you. Thanks, Rishi. Dr. Fauci, as you know, the Georgia Municipal Association represents all of Georgia's 537 cities, and we have local leaders from across the state tuning in right now for this exclusive interview. With that, can you please share the top 3 lessons they, as leaders in their community, should take away from this pandemic to better prepare for potential future pandemics?
Yes, not necessarily in the order of priority,
Okay.
Kelly, but so one of the things is that we need to make investments locally, but also from the federal government with help to the local areas. We have let our local public health systems, health infrastructure erode over years. In many respects, that has been victims of our own success. You know, back decades and decades and decades ago, when you had a lot of infectious diseases that you didn't have vaccines for, you had sexually transmitted diseases, respiratory diseases. Then, as we got really good at it, we pulled back on the support of the local public health. So I think lessons learned when we're dealing with future, we've got to do that. The next, we've got to have the ability to communicate in surveillance, because diseases emerge in the community. And if you could detect them early and have the ability to communicate among yourselves and centrally, for example, with the CDC. The third thing that I think is important is that one of the things that was an unfortunate process that went on during this outbreak is that there was this tension. Should the federal government do it all? Should the states do it all? And the final decision that had been made was let the states do things on their own. Some of the states felt they didn't get enough resources, they didn't get enough direction. I think one of the lessons is we have to have sort of a golden mean, a good balance between federal direction, coordination, collaboration, and support, so that you don't ask the federal government to do it all and you don't ask the local government to do it all. You have a partnership between the federal government and the local. That's really, I think, what we need.
Yes, and thank you for that. 3 very solid points. Thank you. Go ahead, Rishi.
Thank you. If today you had to give us your best professional opinion for a return to normal, when do you think that would be and why?
Well, that's a great question, but it's going to be dependent on a lot of things. And a lot of them relate to the really good questions that you all asked me. Getting back to normal will be very highly dependent on the percentage of people that we get vaccinated. If we really do get 85% of the population vaccinated and we get through and past this vaccine hesitancy, that we could get an umbrella or a blanket of herd immunity over society. And if we do it correctly and expeditiously and vaccinate those people before we get to the middle and end of the summer, by the time we get to the fall, we could be approaching. It won't be exactly normal. I think it's going to take longer than that. But I think as we get into the mid to late fall, we can have enough protection in the community, enough tests available that we could safely get children back to school with the teachers not being anxious about being infected. We very likely could have events like sporting events where you have spectators in the stands or in a stadium. We may modify it a bit, but I think we can get some degree of normality that by the time we come to the end of the year, looking forward, that we can feel much, much different than we do now.
Well, I certainly hope that comes to fruition. Kelly?
Awesome. I think we may have time for one more question, Dr. Fauci. Thank you so much for your time again. Now, the Pfizer and Moderna vaccines are proving far more successful than many scientists could have imagined at the outset of the pandemic. What benefits might the technology used to create these vaccines yield in combating other infectious diseases in the future?
Yeah, great question, Kelly. We're very excited about, as you said, the surprisingly positive results. We never would have imagined that we were going to get 94 to 95% efficacy. So right now, even as we speak, that there are a lot of really good people, scientists, vaccine companies, already doing early studies in HIV, in malaria, in tuberculosis, and even in influenza. So I think this breakthrough in vaccine platform technology not only was very good for COVID-19, but I believe is going to have positive impact on other diseases where we had difficulty in developing a good vaccine.
Dr. Fauci, thank you. Thank you for your time today and your continued exceptional service to our great country.
Thank you. It's a pleasure to have been with you. Thank you for having me.